Dr. Weintraub, thank you so much for joining us on MD Newsline podcast. Can you please introduce yourself to our audience?
Sure, and thank you so much for inviting me. My name is Dr. Jill Weintraub. I am an integrative rheumatologist, which means that I am a conventional rheumatologist, but I have additional training in integrative medicine, so I combine both in my practice and with the way that I treat patients. And I am the founder and chief rheumatologist at Integrative Rheumatology Consultants.
hmm And we're going to be talking about spondyloarthritis. Can you please define it a little bit for us? There's so many people who haven't heard of it. So please just tell us a little bit about the umbrella term as a whole, and then some of the subtypes clinicians should distinguish between.
Sure. So, axial spondylitis is a form of inflammatory arthritis that typically involves the spine. However, it can involve really almost any joint, and it typically also involves what we call entheses, which are tendons and connective tissue. So, a classic example of that would be something like the Achilles tendon. They are indolent and progressive diseases that usually require treatment, and they can be hard to diagnose. Today, we divide them generally into two categories. One is called radiographic, and that used to be called ankylosing spondylitis. And that was the classic syndrome that was originally diagnosed in young men, where they have a progressive inflammation and fusion of the spine, starting at the base of the spine in the sacroiliac joints and working its way up. Today, we make a distinction and we recognize that there is another group that is called non radiographic axial spondylitis. And these are people who also present with inflammatory back pain, but we don't usually pick it up on the initial x ray. So they require additional advanced imaging to make the diagnosis. And today we use MRI for that. So, those are the two basic categories of axial spondylitis. I would say that within that family, there are other conditions as well that may share some of the features or be related. And those would include things like psoriatic arthritis, the arthritis associated with inflammatory bowel disease, and also reactive arthritis.